one of my favorite little sayings is, the way you show up to anything is the way you show up to everything, right? It's why you can't move across the country for a better life, because you take your life with you, right?
Welcome to the Growth and Thriving podcast, where we celebrate those who have overcome adversity and trauma and examine the tools and techniques by which we grow. I'm Dr. Jerry Sunshine Novak. I'll be your host. And today we are talking with Dr. Jen Sparks, a licensed marriage and family therapist and counselor with a practice in Yardley, Pennsylvania, and a good friend of mine for nearly 20 years. Dr. Jen and I know, first met when I was a student in my master's program, and she was a professor of mine. So welcome, Jen. Thank you so much for coming on the podcast. It's great to see you.
Thanks for asking me, Jerry. Or I guess I volunteered, didn't I?
That's okay. I was thrilled that you volunteered. I put out a request and I was so glad that you responded. It's been a very long time.
I know, too long. So it's great to reconnect.
For sure. So just so folks understand, when we first reconnected over phone about doing this, that was a 2-hour conversation of just,
Yeah.
Felt like 15 minutes, but it was So Jen, why don't we start with just, talk to folks about, where you are now, what you do, what sort of work, you like to do, maybe how you help people both overcome adversity and transition into something that feels like thriving or fulfillment for them.
So I currently have a private practice out of Yardley, and spent the last 5 years, about 5.5 years ago, I left my private practice in order to take on a director position at a training clinic. And part of that was because private practice can be very lonely. Mm-hmm. And, you sort of meet people at the water cooler, say hi, and then turn around and go back in your office. And I wanted more of I'm a big collaborator, and I wanted more people to collaborate with. So I took on the director position. It didn't quite go the way that I had hoped it would. And I found that, as we find in most organizations, once you enter into an organization, you now are pretty much reproducing your family of origin.
Right.
And that was a little bit of a problem for me. So I the clinic got shut down. It was at a university, and it got shut down because of COVID. It was on just like contract hours, which I wasn't willing to do anymore. So I left, and I'm now in the process of trying to reinvent myself. I'm not really sure what that looks like yet. I have my private practice. I'm seeing a few clients, and we'll kind of see where that goes. So after our conversation, I really, you got my head spinning a little bit, thinking a lot. And I thought it would be really interesting if I were to start in my own therapeutic process in terms of the healing that comes after trauma. I'm not sure if I were to start that process today, I'm not sure it would look the same as it did when I started 30 years ago. Right. I think we have a lot of information. Neuroscience and the understanding of our central nervous system has changed the face of therapy completely, as far as I'm concerned. I feel like we are just giant nervous systems interacting with one another. Right. And unless you have an understanding of your nervous system, then anything could, all bets are off, right? Anything could happen.
Yep.
We don't have a lot of control. So the process that I would enter into today is very different than the process that I would have entered into when I did 30 years ago. And I'm just now trying to figure out what that would look like to see if I want to use those new techniques in my own therapeutic practice, or I want to go in another direction. So I think that the biggest piece of it is how embodied the work is.
Right.
Historically, 30 years ago, that wasn't really even a blip on the screen. Now we know trauma is stored in the body, and that if you're not going to address the body, you're not going to have a real robust healing process.
Yeah. If you don't start to balance sympathetic and parasympathetic interactions, and you just live your whole life in that sympathetic fight or flight kind of response, then yes, you can reframe and reimagine and write a narrative and tell yourself all the right things. But when something trips the wire for that survival response, you're going to end up in the same place you were, right?
Yeah.
Yeah.
And it can be anything. It can be the littlest thing in the world. Today, I was in a little bit of a rush and had to pick up my daughter at school, and she's 17, so she's a little bit, I know, and that's the young one. Anyway, she's an adolescent, right? And so the busiest parts of the brain when you're in adolescence are the ones responsible for high risk taking behaviors. And what's the second one? We talked about this in human development, high risk taking behaviors, and it starts with an I.
It's like emotion.
ADHD, like impulsive. Thank you.
Oh,
yes, I knew I'd get it eventually. So high risk
impulse control.
Impulsivity, right?
Yeah.
So she had an attitude when she got in the car, right? And that attitude was just like, bam, it set me off because I was in a rush. I needed to get back and set up for this. So anything can set you off, even the most innocuous little circumstances. So understanding that parasympathetic and the vagal nerve becomes really important. So yeah. So
a lot of good information on the polyvagal theory of trauma and how that affects people and that vagus nerve. So just for folks who are listening and might not know what we're talking about, that's very much, that vagus nerve is very much thought to be responsible for a lot of our fight, flight, or freeze, and maybe even faint kinds of reactions. And I'll have some information coming up about that, but I probably won't get too in depth because I don't focus too much on treatment. I focus a lot on the aftermath. But
yeah. Well, so the polyvagal nerve runs from the top of the brain stem down into your gut. It's the largest nerve in the body. 20% of the information goes from your brain down into your gut. 80% of the information goes up from your gut into your brain.
Right.
So if you're not working through the nervous system, the nervous system is really controlling your experience. So the dorsal vagal, which is a portion of the polyvagal nerve, is responsible for freeze.
Right.
And then fight flight is it's the parasympathetic or the sympathetic nervous system that is responsible for the fight flight. Yeah. So the polyvagal nerve and the dorsal vagal portion of freeze is the most, it's the part of you that believes you will die.
Right.
If as a trauma or as something is going on. Fight flight is just ready for that. My blood's going to run to my hands or my feet in order to fight or in order to flee.
Right. And in order to fight or flee, you have to believe that you'll survive.
Right.
You believe
Absolutely.
you won't freeze. Yes.
Yeah. So my go-to place is freeze. I freeze in every occasion, which in some cases is a more positive reaction than fight flight. But it also means that unless I'm working on my stuff, healing can be very slow.
Right.
So because one of the things I've noticed, which I think is so interesting, is that the freeze isn't just in my body, the freeze is in my brain, right? So someone says something and I cannot pull a word out of my mouth, right? I can't talk, I can't speak, I don't have a comeback. So as I got older, all I could do was just sort of sit there, and when it was over, walk away, right? And then I'm left as a receiver of all of that energy that's coming at me. So and one of the things that I think is really interesting, John Gottman, who is one of the biggest researchers in relationship to marriage and family therapy, couples work. I always used to think that I was very patient. And the way that John Gottman reframes that is to say, no, you actually have a very high tolerance for negativity.
Mm-hmm. Yes.
Which I think is pretty interesting. Yeah. So
it's more like a capacity for suffering.
Yes.
Than
exactly that.
Patience sort of implies, or at least in my mind, I imply a sense of like empathy with patients, right? I kind of get where you're coming from, and I'm letting you sort it out, and I'm giving you some space and maybe some scaffolding by which to do that. Whereas suffering, right? A capacity for suffering is like I'm sitting here and absorbing, and I'm miserable, and I'm not sure that there's a whole lot of empathy because I'm really focused on how unhappy I'm feeling and how maybe threatened or unsafe I'm feeling, right? But I'm tolerating, right? Yeah.
Well, and the other thing is, right, that the structuring and the conditioning that happens, in the very early years of your life become the foundation for how you react as an adult. So in a world where there is a real threat of harm, if you move or speak or do whatever, then you learn to just shut down. And until you manage the nervous system, so for instance, that shutdown is going to have a set of thoughts and physical sensations that go along with it. And I could do something like cognitive behavioral therapy, CBT, which would say, okay, so what's the thought and what are we going to do with that thought? But the thought isn't enough to change the experience. The body has to believe the experience as well. So that's also that positive psychology piece. If you're only working on the thought as a positive thought, it's not really going to go anywhere. It's not going to take, because your body has to believe in the positive experience as well.
And interestingly enough, I mean, the positive psychology guru, right, Martin Seligman, was also responsible for demonstrating the power of learned helplessness, right? He had dogs in crates and put a little electrical current through the floor, so and they couldn't get out, and they would try for a while. And after a while, they would give up and they would lie on the floor of the crate. And even with the crate wide open, the door wide, not just unlatched, but wide open, he would run the current through, and the dogs would still stay there and absorb the electrical shock because their bodies had learned that they couldn't escape. And so for the folks, I think very often when it comes to mental health kinds of things where you can't X-ray and see like a broken bone or a torn ligament in an MRI or something, there's this idea of like, well, maybe it's time to, get over that. Or if that was a childhood thing, maybe, but what I think is a better metaphor, what helps people understand in my experience. And this draws on my own, like I was a personal trainer for a long time before I became a psychologist. So I'm always thinking in those terms. But, if you were to go to the gym and lift weights regularly, your physiology would adapt to that stimulus. And your muscles would grow bigger and your ability to produce force would increase and you'd get stronger. And your body, your physical body would change as a result of the stimulus and the recovery periods in between. And not too many people struggle with that idea. Most people understand that. So when we're born really unformed. I mean, our brains are far. And in the last 20 years, we've started to appreciate that our brains develop throughout the whole lifespan. But for sure, they develop very rapidly in the first couple of decades, right? And they develop in response to external stimuli. So if you're growing up in an environment that's very safe and loving and nurturing, your brain and subsequent nervous system develop with that as a central worldview and building off of that. Whereas if you develop in a less safe environment, your brain and your physiology and your nervous system literally responds and develops physically into a safety survival based kind of mechanism. And so just thinking differently, like you said, is not going to change. It's like just thinking differently about your physique and not working out, right? It responds to stimulus. So yeah.
Although there are studies that say that if you visualize working out, you actually grow more muscle tissue than you do if you don't work out at all.
But the caveat is so and again, the idea isn't to discount the importance, even with something like CBT, right? Cognitions and behaviors matter. Cognitions and behaviors are important, but they're not the entire
whole picture.
Right. And that approach to therapy came out of a period in time where the general consensus amongst especially the behavioralists was that things that can't be measured, like thoughts and feelings, shouldn't even be dealt with. And so we can measure behaviors. And so that's what we looked at for a while. And so those, are important. They matter, but so do sensations and so do emotions and I think that's what we're getting at. And so I absolutely, as a performance coach, I think visualization of what you want and starting to imagine what it feels like in your body to get it and what it would look like to have it is important. But without other efforts, it's probably not going to get you where you want to be.
Right. Yeah. So so I was born to a mother who was mentally ill. I believe she was probably undiagnosed schizophrenic, and a father who really didn't want to deal with it. And so was gone most of the time and would come home and find her coiled up in a ball in bed with the door locked. So I would be roaming around the house. Once I was found underneath a shelving system. I had tried to crawl up a shelving system and the shelving system came down on top of me. So there was a lot of physical injury. There was a lot of abuse. My parents got divorced, and then I lived with my mom for a while until my dad remarried, and I moved in with him and his new wife when I was about six or seven. And life became very different at that point, but those first 6 years were pretty problematic. So I had a lot of work to do early on. There were memories that I had always had, but had been the thought, the message that went along with the abuse was from the perpetrator saying, well, I'm showing you what it means to be a girl. So I had the memories all my life, but the thought attached to it, never in a million years occurred to me that it was abusive.
Right.
So once I was actually doing it very, very early on in my career, was doing a lecture on abuse, and kind of stopped dead in the middle of the lecture, realizing, oh my God, that memory is a memory of abuse.
Right.
So that started the journey, and it all started with talk therapy, which to have someone be present and truly listen and understand, there's nothing like that.
Yeah, it's powerful.
Right? To have to know that there's somebody else in the world who knows you and accepts you, because trauma, most of the messages from trauma are problematic messages, right? That it's all about you and you're the problem and you're the issue. So that was really powerful. But I entered into, so I did a lot of talk therapy, and then I entered into my master's program, and it was an addictions program that was based on alternative healing methods. So I got introduced to a lot of different stuff. I did breath work, which is using your breath to put you in an altered state of consciousness that sort of sends you. You and I were talking a little bit about the psychedelic drugs and using them for trauma healing. So it's sort of the same thing. It puts you into an altered state, and it sort of opens doors, and you understand things differently. So breath work was really helpful. I did some therapeutic touch, which is really energy work. That personally for me, the mix didn't work. I did some shamanic work where you're working with a person who has been trained from a shaman, and they take you on a meditative healing journey, which was insane, because I was just sitting there and she was talking about what I was seeing in my head. Like the pictures that I had in my head,
right,
she was talking about when I wasn't speaking at all. It was really crazy. It was very, very helpful. I have done EMDR. EMDR was really helpful.
yeah.
I did Phoenix Rising yoga therapy, where you go in and you talk to the practitioner for maybe a session or two. They ask you about what the issue is that you're trying to work on, and then they choose a yoga pose, and they place you in the yoga pose, and then they put pressure on different parts of your body, and the release is intense. It's very intense. That was incredibly helpful. So there's been an array of things that I've tried. EMDR was probably the most scientifically researched, helpful therapy that I've participated in. And I know that brain spotting has the same results, but David Grant has not done the research that Francine Shapiro did, but he's not as proprietary around it either, which is helpful, so that there's access to the masses. Right. So that's been a pretty long journey. I think I've been participating in my healing for about 30 years, and it changes all the time. But the really basic conditioned feelings and beliefs are what it always comes back to.
Yeah.
Go ahead.
No, I was going to say I had a similar, you and I had a similar circumstance. I mean, or at least some similarities. I grew up being told that violence was just how you raised boys. And I wasn't given a lecture, but I was well into my adolescence the first time I realized that my cousin, with whom I was very close, we were kind of like brothers, didn't get hit.
Hmm.
And it was like a shock. I couldn't believe it, because he would say things that were normal kid things to say, like, "Oh, my dad will kill me if he finds out about that." And I just assumed I knew what that meant.
Right.
And so the first time I realized that other people don't have this experience, it was a huge shock for me.
Yeah.
And I had a couple of other sort of wake up calls until at some point in my early 20s, I realized that like the person I was in the world was not really the person I wanted to be in my, imagined self. And so I started therapy, and it was, cognitive behavioral therapy. And I was lucky. I had a therapist who was really exceptionally good.
Yeah.
And man, she kicked my ass for maybe 8 years, and kicked my ass in such a way that, when I say that, I think people might imagine this drill sergeant kind of, and it wasn't that at all. The way she kicked my ass was by getting me through some verbal judo, getting me to discuss and reveal the parts of myself of which I was most ashamed, and accepting me anyway.
Yeah.
With my belief that, I was unlovable at baseline, no one would want me. And here she was providing that corrective emotional experience. That was huge. And it took me very far. After that, I did some various different therapies, also art therapies and different things, and with varying degrees. I don't want to say that the therapies were so great or not so great. I think I had some providers that were more or less skilled as well.
Sure.
And then EMDR, for me, what I found was with a lifetime of history, EMDR that focused on physical sensations, on body sensations, that was, sort of somatic re-experiencing mixed with EMDR, was way better for me than EMDR, where you thought of a particular instance in a memory and, had your light bar, or your hand buzzers or whatever. Because for me, there was there's no individual experience that stands out as particularly worse than others, right? It was just my normal life.
Right.
And so getting things that triggered me and then focusing on those sensations and working with the bilateral stimulation through those sensations, that was powerful.
Yeah.
And then most recently, I went and did a guided psilocybin journey with a huge dose of psychedelics, and it just blew the doors off of a lot of what was stuck. And that was a profound experience, really profound.
Yeah. I look forward, you have, well, I guess there are some places around here where you can go on a journey, a healing journey. I think you have probably had a greater connection and network that led you to that particular person than I have here, because I think it's something I've had several clients do ketamine treatments.
Yep.
It was when someone is uncomfortable with drugs and highly sensitive, just the taking of the drug can prevent sort of the acceptance of the process and where it takes you, right? And they're going to take you to good places, and they're also going to take you to bad places, and that's part of the journey, and sort of needs to be done. I think that I have a little magnet in my office that says everything that you want is on the other side of fear. And ultimately, I think that that's what we're trying to move through is our fear of the fear. And I see a lot of clients struggle with that.
Yeah.
So, and I agree, there are so many different modalities out there, and it's going to be different for every person. Right? So there are some modalities that float up to the top. EMDR is definitely one of those. And my experience of EMDR was that it was instantaneous. Yeah. That once I got something, it stuck.
Yeah. Yeah.
And they will show, like, if they take pictures of the brain before, during, and after, what you see, that the brain is divided into two hemispheres, and the right hemisphere it's where emotion, connection, spirituality, creativity exist. And right in early trauma experiences, especially attachment experiences, that's where things get lodged. It's where they get stuck, right? So the left hemisphere is responsible for language and logic. So a lot of that stuff doesn't get, when you're really young, it doesn't get processed because you have no language to put to it. So it just kind of hangs out there. And so the pictures that you see that they take prior to having an EMDR session, if you talk about the situation or a feeling or a thought, whatever that may be, you see it, the electricity going on only in the right side, the right hemisphere of the brain. Midway, what you see is you start to see that the electricity is going back and forth between the left and the right hemisphere, which means things are starting to process. And then you can do post imaging, and you find that there's still, when you talk about that issue, there's still the back and forth, whereas something like CBT is only it has a recidivism rate of like 2 years.
Right.
So it happens instantaneously and it sticks. It doesn't mean you don't have to go back and work on an issue a little bit more, but it is pretty powerful experience.
Yeah, that going back and working on it more is usually because you have changed in relation to your trauma, as opposed to like the treatment didn't stick, right? We're always changing, evolving.
Yeah, I also think that when they talk about, so I'm EMDR trained. And use it in my practice. They sort of talk about it as a tree, right? And so if the issue is the trunk, there can be a million different branches that lead to that issue. And so you may clean out one trunk, but you may find a couple days later or a couple weeks later, whatever, that it triggers something else that leads you back to that same issue. So the idea is to kind of clear all of that out so that the issue is free. And even still, I think your last podcast, you were talking about the spiral staircase. Yes. Right. That you operate on the same issue, but you're kind of walking, you revisit it over and over again throughout your life. I've always talked about it as fusilli pasta. Yeah. Right. Okay. Spiral pasta. Yeah. That's funny. But you're always moving forward. Right. But you're gonna wind up revisiting that particular issue, even if it's to say, oh wow, that's something I would have normally reacted to and I didn't react this time. Right. Yeah. Yeah. So when I was getting trained in EMDR, I came across a study that was very similar to what you were talking about, but a little different in an interesting way. And it was done with veterans, combat trauma, through the VA. And what they found was prior to treatment, these folks, when they were triggered and suffering from, what we would call PTSD-like symptoms, the amygdala, right, the part of the brain that connects memory and emotion, was on average, they called it swollen. What they found was on average, the amygdala was larger than what we would expect the average person's to be, and that it had quite a lot of metabolic activity. And they treated these folks with EMDR, and they found that after the treatment, the amygdala had shrunk to what we would expect a normal size to look like, about the size of an almond, and that the hippocampi, where we store old memories, long-term narrative memories that don't upset us, had then increased in metabolic activity. And I don't know that other treatments wouldn't, necessarily produce similar brain scans, but it was interesting to me that the EMDR, had this, this physiological, we always want to say, oh, well, that's, a placebo effect, or it's this, or it's that, or it's the re-exposure piece. It's not the bilateral stimulation. But I mean, at least this study demonstrated that there was legitimate physiological difference in brain functioning and structure as a result of the treatment. Yeah. That amygdala got too much of a workout. Yeah, right. It grew too big. Exactly. We had to let it rest a little bit. Yeah. It's only supposed to work in spurts. It's not supposed to be on duty all the time. I would have to say that I think and I think you would probably agree to some extent, the most helpful model that I have experienced is some version of ego state work.
Yeah.
Parts work, internal family systems,
Family systems,
ego, right? That for me has probably been the most helpful and the easiest thing for me to reproduce in relationship to being out in the world and trying to figure out what to do next, right? Because I think one of the things that we have done as a profession, certainly not on purpose, but we've kind of made a lot of our clients dependent on us, right? And I think it's really important to find clinicians that are willing to give you the tools so that when you go out in the world, you can take care of yourself. Because otherwise what we do is you go in and you start talking about memories without having any skills in place. And it's like, I rip you open and send you out bleeding.
Right.
And what perp isn't interested in a bleeding?
Right. Yeah, right. What predator doesn't want bleeding prey? Yeah, for sure.
Predator is a better, yes, predator is a better. Smell blood from miles away.
Yeah.
So the ego state work, parts work or internal family systems, I think does an amazing job with that.
I got my first introduction to that from you when I was.
Oh, really?
Yes, when I was leaving New Jersey to go get my doctorate in Indiana, you gave me Richard Schwartz's book, your copy of it, all highlighted and notated, and yeah.
What? So do you still have that?
I do.
Or did you give it back?
Oh, I still have it.
You need to send it back.
Okay.
I need that book.
Okay.
That's so funny. I was wondering where that went.
Okay.
I wonder how many of my books I've given away.
I'm in the midst of moving. Everything is packed, but when I come across it,
that's fair.
I move. But yes, you said to me, this book changed my whole perspective on things and gave it to me as a sort of a moving on.
So I'm taking it back.
That's fine. That's totally fine. Yeah, it was my first introduction to Richard Schwartz and to internal family systems.
So is that something that you use, that you historically you've used in your practice?
Yeah, Bessel van der Kolk would be very pleased with me. I use that. I've used neurofeedback. I use a lot of EMDR. I recommend, I'm not qualified, but I recommend a lot of trauma-informed yoga. I am trained in auricular acupuncture, which not really in and of itself a trauma treatment, but it is effective. It's usually a treatment for
addiction.
You're right. But what they found in subsequent studies is that it does help calm the nervous system. It helps people chill out a little bit. So I use it for symptom management with trauma. I had a couple of cases when I was doing therapy of people who were so traumatized. I had one person who was an Army Ranger at Mogadishu, like the Black Hawk Down movie. Yeah, that he just couldn't talk when he came in, right? He would lock up, like you were talking about, he'd freeze and he couldn't talk. And so all I did for several weeks is have him put his feet up, put in the auricular acupuncture, and set up the neurofeedback to down train those sort of arousal centers, and do that for an hour at a clip. And I don't know, maybe 5, 6, 7 sessions in, he was sitting there and he would doze a little bit while he was doing that. And he shot awake with like a memory, and boom, therapy started. And we were in, and I would have him, I had a couple of people who I would start that way. And what I would do is I would have them hold the EMDR hand buzzers just in case. And so after, 6, 7 sessions of not needing them, and just that he shot awake and he had all this panic, and we turned on the buzzers and we did some bilateral stimulation and jumped in, and that was our entrance. And so it was a good tool. Yeah. It was helpful.
Yeah, I parts work really bodes well with this, but I talk about managing the symptomology before you do the deep dive.
Right. Yes.
Right.
Right.
Which I think is really, really important, because people who are not well trained in trauma treatment will go straight for the memories, and you're basically re-traumatized, opening up to be re-traumatized.
Yeah. When I was supervising master students, when I was, supervising newer clinicians, one of the things I found myself saying a lot is, if you're going to ask how that makes them feel, you have to be prepared for the meltdown, right?
Mm-hmm.
Otherwise, don't ask. Like, you can do other things that are useful, right? But if you're not prepared to handle full on ugly crying, shaking, then I wouldn't keep asking for them to dig,
Yeah.
and develop that skill set first. So I usually describe to folks when they're getting started, and I describe trauma treatment as having 3 phases, and they're not distinct. They can ebb and flow back and forth a little bit, but phase 1 is exactly what you're talking about. I call it getting the nervous system to chill out a little. It's just managing the intensity of those symptoms, right? And I would tell people, like, I know we're getting close when you can come in and I hear you say something like, I went to Walmart with my family the other day, and as I was leaving, my spouse was saying how great I did. And I was like, what do you mean? And they were like, oh, well, it got crowded in there and you didn't even freak out. And I didn't even notice. And I'm like, those are indicators, right? I listen to that kind of thing. And that's phase 1, right? And that is just a lot of yoga, a lot of mindfulness, a lot of breath work, a lot of acupuncture, neurofeedback, right? Phase 2 is the reprocessing of the trauma, the deep dive, memory, EMDR. I don't personally do prolonged exposure, but I guess that's where you could do it if somebody was inclined to use that approach, or something like a CPT, like a cognitive processing. But that's the revisit those memories and figure out how to fit them into your worldview kind of place, right? Digest them. And then phase 3 for me, and this is where I think a lot of clinicians, even ones who are skilled at working through the deep dive, fall short. And maybe it has something to do with health insurance and managed care not paying for it. But phase 3 has got to be like, okay, what is life going to look like now? Because there's no rewind button. You can't go back to who you were before the trauma, right? The trauma will always be a piece of your history. It just can represent the reason why you have to suffer, or it can represent the reason why you have to thrive.
Right.
And so to me, that phase is often overlooked, but super important.
Yeah. Yeah. It also, they all sort of clump together. I think a lot of addiction evolves out of trauma.
Right.
But it's sort of like clients who are addicted, let's just use alcohol, for instance, like, okay, you got to find new places to hang out. You got to find new places, people to hang out with, right? Your vibe to find your tribe. So often in that sort of integration or reintegration piece, you're really looking at your social networks and are these people that are in support of your trauma, or are these people who you have connected to within and from your trauma, and now are continuing to re-traumatize you in some sort of way, or you're not that they are doing it to you, but you are re-traumatized in the midst of that relationship. And that can be really, really hard, right? And in some ways, as you said, it's not linear, right? These things can kind of go back and forth to some extent, but there can be a lot of grieving during that time, because you're having to give up things that are not good for you and can pull you back in.
That's one of the big hurdles that I think, in my own experience, and I don't know if there's data or literature on it, but there might be, I have no idea. But for me, I think I made, baby steps throughout therapy, but then the psychedelics really turned the corner for me. Was this idea that, for me, grief and trauma started at birth. I mean, my mother was sick my whole life and died when I was 7, and my dad had a temper and there was violence, and even when I was 3 and 4 years old. And so things were, so I think what happened was I managed, like, the traumatized kid, or it somehow became a piece of my identity, of who I was.
Yeah.
And healing from it meant losing a piece of my identity.
Yeah.
And it was, I started to come to grips with, like, well, I don't really need that piece in my identity. And on a cognitive level, I think I got it. But in my body, there was still panic about, like, who am I without that, right? Who am I? And that's a big piece. I think I would suspect, my suspicion is that that's part of the importance of meaning making in recovery, right? Is that there's a new piece to your identity now. For me, being a kid who had some trauma and abuse was a big piece of my identity. Now my involvement in something like BACA, like Bikers Against Child Abuse, sort of scratches the itch, if you will. It feeds that identity piece in a way that's meaningful for me, without me having to continue to walk through the world as the traumatized kid.
Right. Yeah, absolutely. I have noticed for both myself and my clients that there's an experience and an identity that goes along with I'm an abuse survivor, right? And that's sort of it's either unconscious into consciousness of surviving something, or it's acknowledging it
Right.
for the first time, really. And it's interesting to me because we haven't caught up to our language, like our body has not caught up to our language in that way, because the very definition of survivor means that you've already been through the trauma. Right. But based on the nervous system and the conditioning, you're living in the world as if it's happening in this moment. Right. So from survivor into sort of this place of gratitude. Yeah, that happened to me. And there are parts of myself that I really, really love because it happened. And so I wouldn't want to wish it on anybody. Right. But it is those right, that if you can go to the depth, that the depth of fear and sadness and shame, and come back, it means that you can go that much higher, right? Instead of just like an inch above and below the baseline, you're 10 inches above and 10 inches below. So there is a lot of hope and healing that can happen. And I think more so now, not only because of the what we've learned in relationship to how trauma gets imprinted, basically, but also we just know more about it. We're more accepting, we're more understanding, and now we're even starting to see organizations and the last place that I was at was trying to look at becoming trauma informed, which really isn't enough, and we've already moved on from that. But it was a state institution, so good for them for trying.
It's a start.
Right. So there's a lot of hope.
Right.
There's a lot of hope out there, and there is, right, that identity change that you were talking about, from surviving into sort of, that was my history, and I'm thriving now. It's an amazing process. That's such a great message to get out into the world, and so important.
You almost said verbatim the quote that I tend to hear over and over again from people who have really, really grasped the thriving, the growth piece, right? And to be clear, just to be realistic, thriving is not, there
Right.
isn't a such thing as an end state. There's no such thing.
Right.
We're always works in progress. And there will always be some residue of your history with you, always, right? And so if you've had severe trauma or really serious adverse childhood experiences, you may for the rest of your life occasionally have a nightmare or get triggered by something that's could happen. That doesn't necessarily go away completely for everyone. But the quote I hear, and you sparked it because you said the first bit was, I wouldn't wish it on anyone.
Mm.
The second part that I tend to hear, I've heard a handful of times, is, but I wouldn't trade it for the world.
Yeah.
Right. And you were saying, I've come to love parts of myself that wouldn't exist if they didn't have to overcome these tribulations.
Yeah.
Yeah.
Yeah. Our challenges are usually also our greatest gifts, right? It's just a matter of learning what it means to be a challenge and how to navigate and manage that challenge so that you can use it. I know I have pretty strong insight. I'm a pretty insightful person. When I am not using it in the appropriate moments, it backfires like there's no tomorrow, right? And
Yeah.
sends me right into really, really problematic relationships and scenarios. So I have to be really, really careful about that. But when I'm using it in an appropriate way, it can be really helpful for both myself and other people.
Sure.
So yeah, that clear seeing can be kind of difficult sometimes.
Yeah. And it's like, it's hard to manage that and to keep some awareness around it, some sort of presence with it. And it's also hard to clean up the mess when you haven't, right? When it's gotten off the rails a little bit. But it's also hard to not cultivate that kind of, insight and awareness and to go through life missing people and not connecting and not having that. And so you just get to choose which hard you want, right?
Yeah.
And
yeah.
One hard results in deeper connection and sort of meaningful experiences. And the other hard is maybe feels a little safer. It's a little less vulnerable.
It's the devil, right?
Yeah, the devil, exactly. So I was going to ask if we could circle back to something you had said in the very beginning of this conversation.
Sure.
You said it and it hit me as really interesting, and we kind of moved on. And so I thought, well, let's just see where things go. And if we don't get back to it, we don't get back to it. But it's kind of lingered there. And I suspect it might be something that a lot of other folks listening or watching might be able to relate to. You started off when you were talking about leaving your private practice to take that director position. You said that you are a person who thrives on collaboration and you need people with which to collaborate. And that's something that's very important to you. You also said that in every social or group circumstance, we recreate our families of origin. And it made me think very much of Schopenhauer's porcupine.
Porcupines.
Yes, right. And so for those people who don't know, there's a philosopher named Arthur Schopenhauer, and also I think Sigmund Freud had a porcupine on his desk too.
Yeah,
and the idea with the porcupines is that in the winter they get cold, so they all huddle close together for warmth in their den or whatever. But if they get too close, they prick each other with their quills, so they pull apart because it hurts. But when they pull apart, they get cold because it's winter. So they all come together in their den and they spend the whole winter in this process of coming together for warmth, then pricking each other and hurting each other, pulling apart for safety, but then getting cold and coming together. And the idea is that people are like that, right? We come together for warmth and for closeness, and then we hit each other's sensitivities and pull apart. So I was wondering, as somebody who says she needs that collaboration, but then has this dynamic where we end up recapitulating our early experiences in groups, which is a well-known phenomenon. It's not psychobabble or
Right.
the real thing. I'm wondering, how you approach that, how you think about it, how you manage it, how you help other people manage it. It's a sticky situation.
Yeah. So the directorship, I mean, it had its own unique experience because it was a job where a portion of the employees were union and a portion were not.
It's hard.
And union is always appeased, always, unless you've killed somebody, right? And it's not a condemnation of union. It's just it's like a gun, right? It's not about the gun, it's about who's pulling the trigger, right? So it was a particularly difficult situation for a whole lot of reasons. What I do is I'm pretty clear when I've been triggered, because my entire body, the first thing I experience in any triggering event is that I start to shake internally, right? So that's my first clue to be aware that I've been triggered and that I am probably moving into freeze mode. And then I have to pay attention to my thoughts and what it is that I want to say, and ask myself whether or not that's appropriate. So I tend to slow way down in those situations. The thing about, and of course, it's not just in the job, it's also in my family, it's amongst my friends, right? It's everywhere. One of my favorite little sayings is, the way you show up to anything is the way you show up to everything, right? It's why you can't move across the country for a better life, because you take your life with you, right?
Everywhere you go, there you are.
There you are, right? So one of the big lessons over time has really been, and I think Schopenhauer's porcupines is the same. Like, we cannot avoid hurting one another. It's impossible. We are imperfect, and thank God, because otherwise, we'd all be the same, or we'd be dead, right? I don't know.
Boring.
In heaven.
Sure.
I don't know, right?
Uninteresting, at least, yeah.
Differences are what makes the world go round, and differences are what, you pull the smallest part out of a car and it won't run.
Right.
Like, every part has a purpose, right, and a meaning to the system, and if you pull it out, it's going to become a different system. So part of it was through my healing process, understanding that we hurt one another. And it's inevitable. We're going to hurt one another. It's not about concentrating on the hurt. It's about concentrating on the repair.
Right.
And the I'm sorry is not a repair.
Right.
There's a difference. So Sue Johnson, who's emotionally focused therapy, talks about 3 pieces to that. Part of that is the person who's done the hurting needs to be able to hear the difficulty, the emotional difficulty and the pain of the person who's been hurt. Once that person feels like the hurter has heard and understands, then the hurtee softens, right? They're more open to hear what's going on. So then the hurter can say, oh, I know I said that to you and I regret it. It was a horrible thing to say. I was in such a bad mood. This and this and this had happened and I wasn't thinking, and it just came out of my mouth, and I'm so sorry about that. So that's the second piece. And then the third piece is coming up with a plan. so that it doesn't happen again, right? And so that becomes much more meaningful when we're talking about, because what happens in terms of communication is that when we think about the way we show up to anything is the way we show up to everything, we are the same kind of communicator in every aspect of our lives. And that communication is conditioned, just like Pavlov's dog, when you ring the bell, he's going to salivate whether the food's there or not. We are conditioned to respond to an attack, to contempt, to whatever is coming at us. We're conditioned to respond in a very specific way.
Right.
So the piece that becomes really important is the plan at the end in relationship to how we're going to do this differently the next time. Otherwise, what happens is you get this cycle of there's a fight, somebody's been hurt. We go around the circle, going back and forth to one another, throwing jabs, breaking, whatever you're doing in that fight, to the point at which all communication stops and people usually go to their corners for a little while, right? And so you're hanging out in your own little corner for a little while until someone hands out an olive branch. And then we pretend like everything's better and we pretend like it never happened.
A new honeymoon phase, yeah.
Yeah, and so, and then it's just a matter of time before that starts all over again. So really it becomes, it's less about, right, it's painful when we hurt each other. That's a part of life, right? We have nervous systems, so we feel pain. But it's the repair and it's the communication that's going to change the relationship. Right. And change the, limit the amount of pain that we feel when our spines, not our spines, our quills pop.
Yeah. And it sounds like there might, need to be, or maybe it's beneficial if there's some resilience cultivated as well, because it's great when you can count on the other person to want to work through that process with you, but there are people who won't.
Right. And that's probably the most common when I see individuals who maybe they're in because of domestic violence, they are in a narcissistic relationship, they are in whatever kind of relationship where it's not working with their partner. The most common question is, how am I going to know the next time, right? How am I going to know that relationship is going to work? First of all, you're not. Right. So part of this is trusting in yourself, but also, the things that are problematic for you. Mm-hmm. And so we can't be lulled into the devil that we know because it's safe. Right. Yeah. When we see that red flag, we have to say, oh, that's a red flag. And if we begin to start finding excuses for why that red flag exists, we know we're back there, and we need to move back and take a little time before we jump back in, or maybe we choose another relationship. But if you have a history of being in relationship with people who hurt you, right? The hurt is inevitable, but how we repair it is not. So you're out there looking for people who can repair.
Yeah. And I find in my experience, and again, I don't know if there's literature on this or not. I think there is actually. I'm trying to remember, but I think there is, but you don't even have to be particularly skilled. The intention and the desire to work through often trumps the actual skill level of the person trying. So even if you're a little clumsy with it, or your words aren't quite so, you're not quite so poetic about it or whatever, the desire to recognize that the other person, right, has been hurt, even if you didn't intend it, even if you didn't intend to hurt them, right? The idea is that when somebody says to you, what you did or said hurt me, you don't get to say, no, it didn't, right?
Right.
You can appreciate even if you didn't intend it, and say, well, you're important enough to me that I want to, I didn't intend that, but I want to correct it, that intention goes further than your actual skill level in that conversation. What Sue Johnson, since you brought up Sue Johnson, what she calls the hold me tight discussions.
Yeah.
Right.
Yeah.
I was just going to say, since you brought her up, I'll give a little plug. She was very recently, like maybe in the last 2 weeks, on the Tim Ferriss podcast. Anybody who likes podcasts, and most people know at least Joe Rogan and Tim Ferriss, check out his interview with Sue Johnson. It was
wow, that would be interesting.
It was interesting. He himself has quite a trauma history, and they talked quite a bit about various things. Yeah.
This piece of and I think that we learn. I was running back and forth between stuff today, and there was a conversation on the radio about the world would be a very, very different place if we replaced lawyers with spiritual healers.
Mm-hmm. Right.
The listening is so important. As you were talking about, even if I didn't intend to hurt you, but right, I can't say that I didn't hurt you. I hurt you, but I can't, but I can say I didn't intend to, right? But even in trying to understand the other person, like if you let go of your own pride or your own fear or your own whatever of hurting the person, you actually learn something about your partner and who they are, because the fact that they were hurt in and of itself has more to say about them,
right,
than it has to say about you, because you could say or do the same thing to 10 people and they would all react differently and half of them wouldn't be hurt. Right. So I think that piece is really important too, when we're trying to be in relationship and we don't want our quills to pop.
Yeah.
That we're understanding that when we're listening to someone about how they're hurt by us, we're really understanding more about their psychology than we are about maybe our own behaviors. Not that isn't important too, but
right. And very frequently it's an opportunity to learn about where someone else might have mistreated them.
Yes.
Right. That's why it hurts, is because probably somebody else mistreated them, and maybe their intentions were not as good as yours or mine, right? Maybe they intended to hurt them or didn't care or something of that sort. And so, right, if we can either win, right, we can either put our foot down and say, we didn't know, I didn't hurt you, or no, that wasn't, or if you really matter to me, I can learn about where maybe you've been mistreated in the past. And while certainly I don't need to take the blame, it's not my fault, it doesn't matter. I can, help create the environment that allows you to heal more, right? Yeah. Just like if you came to me with, with the flu or something, I could, put you in bed with a heating pad or a cool pad if you needed one, and some chicken soup and, whatever. I could give you the environment in which maybe I can't heal you, but I could create the environment where you can heal.
Yeah. So I have a question for you.
Yeah.
Somebody maybe who's just starting to recognize their trauma or considering getting into some sort of healing modality to deal with the trauma. How do you approach that today based on what we know today as opposed to 20, 25, 30 years ago?
So how I approach it, now let me start with today. I'm actually, I would make referral because I'm not doing therapy right now.
Right.
I would make referral, but I imagine you saying hypothetically in a therapeutic situation. So I'm still of the belief that the relationship is vital.
Yeah.
That the relationship is necessary. And I'm a patient therapist, and that plays out in other areas of my life. People who know me from jujitsu know that I'm very patient on the mats too as a jujitsu player. I'm not super aggressive. I wait for opportunities. And so I invest a good amount of time in just building the relationship and hearing them and hearing what their goals are and what their wants are and letting them know me. And I believe in being human as a therapist. I'm a big believer in that, you know, with the caveat that you can't change the session focus to yourself, I still believe that self-disclosure and vulnerability on the therapist part is very important. Do not believe in tabula rasa, right? In the blank slate.
Right.
And so that's the first piece. And I try to, certainly some clients who come in, I can connect with very quickly. We have a lot in common. It's very easy. Some folks are a little more difficult, just because I'm not interested in what they're interested in, or, you know, maybe it's something about their mannerisms, or, you know,
they trigger you.
Something, right? They react,
Right.
we react to things too. And so I try to take a few minutes before I go into the room with them and just get in that Carl Rogers unconditional positive regard kind of mentality, right? You have to just want good things for them. And I invest a good amount of time in that. As that's increasing, that relationship quality is improving, hopefully. And I believe in checking in regularly about how the relationship's going and how it feels for that person. And as that is improving, then I start to sort of weave in some of what I would call that phase one of like ideas that might help manage their symptoms a little bit. And I'll tell you, in my experience, helping somebody decrease their distress levels is a potent trust builder.
Mm-hmm.
And, you know, if they've been suffering for a long time and you introduce some sleep intervention that helps them feel, you know, 5% better, you earn a lot in the relationship, right? Especially when the intention and the desire is legitimately just to make them feel better. And so then that sort of transitions gradually into the like symptom management piece and trying to spend a lot of time on what is helpful for them. Things that aren't helpful, I'm not, you know, I viewed my education in trauma work as collecting enough tools so that if a patient or a client, I was in the military, they call them patients in the military. If a client doesn't like one or isn't having good benefit with one, right? If the client says to me, I hate meditating, I can just throw it out and use others, right? I don't have to convince them to use the one because it's the only one I have. So I try to, you know, I've used biofeedback. I typically the heart math program
Mm-hmm.
for
Yeah.
for the heart rate variability measures, because that's a big indicator of trauma. You know, I try to encourage mindfulness practice. I encourage yoga. I've used neurofeedback, but all these different tools that help dial down that nervous arousal.
Mm-hmm.
And while doing that, I try to maintain the focus on the relationship and the interpersonal and an eye toward what's going on in their life now too, as well. That matters, right? And that's sort of how I get into it. And then there's a transition into like, maybe it's time to start talking about some emdr, right? Maybe it seems like you're doing a lot better in a lot of ways. Maybe it's time to deep dive and see how they feel about that. And I try to be, I don't particularly, I've never been comfortable in therapy or personal training with the expert role. So I try to sort of engage them in a collaboration about what the progression into something like EMDR might look like, and let them know early on that after that is a period of creating a new normal and what that might look like and how that might work. And so that's sort of been my approach, you know, but it all occurs on the bedrock of a relationship of, you know, real caring and a real desire for good things for that client. You know, does that answer you? Or
Yeah, I'm just thinking about a lot of people, so I'll get a lot of calls from friends or family who decide that for one reason or another, they or someone they know needs therapy, and what do you look for and what's important, and that can be a conversation in and of itself, right? And so as I think about, especially in relationship to trauma healing, what kind of things you're looking for. I hear you talk about a lot of flexibility. I hear you talk about making sure that, like we talked about earlier, somebody has the tools to navigate their nervous system and their those things that feel out of control. They're able to manage and navigate that. Relationship is absolutely important. The most of the literature points to that being one of the top, outside of doing your own homework. I have to say, right? If you're not invested, it's not going to work. You have to do the work, and the session is only a portion, a very small portion of how you heal. So I think that conversation is always important. When you, so now as a coach, I guess is what you're calling yourself, as a coach, I would imagine that part of what that is about is assessing how ready someone is for change.
Yeah.
Because I would imagine that process looks very, very different than the therapy process, which change may not even be a thought in a client's mind.
Yeah. So let me double back just for a second, because there were two things that came up when you were talking about the relationship that I did very purposefully as a clinician, that I think are important and probably worth mentioning, especially if people are listening to this thinking about how to find a therapist. And I would say a good therapist is very similar to a good personal trainer in the idea that they can give you what you need wrapped up and packaged in what you want. Right? Personal trainer, everybody wanted six-pack abs, but a third of the people came in limping from back pain. And it was like, well, I have to be able to address the back pain, but also in such a way that they can see some progress with getting leaner, right? I have to package it in what they want. And same thing with therapy. I have to be able to give people what they need and what they may not realize they need, or what it seems like they need, right? I could be wrong, but what I assess that maybe they need, and I have to package it in what they want. The other two pieces, so I specialized as a military psychologist. I worked with a lot of combat trauma, a lot of Green Berets, a lot of Army Rangers, handful of Navy SEALs, a couple of Air Force Special Ops, SEER, things like that. Outside, well, in the military and outside in my civilian life, I specialized in working with sexual assault survivors. And so in building the relationship with sexual assault survivors, especially most of whom were women, and I'm a big dude and I'm tattooed and I'm bald headed and I ride a motorcycle, and building a relationship required a lot of empowerment and autonomy for them.
Yeah.
I had to allow them, because sexual assault is one of the most disempowering, and unfortunately, a lot of sort of social norm gender scripts are disempowering for women too. And so I did a lot of allowing, not allowing, but like a lot of hanging back.
Yeah.
A lot of just empowerment and autonomy for them. And they would start typically kind of hesitant, like, oh, is this okay? And yeah, of course it's okay, and so there was a lot of behaviorally, not just verbally, but behaviorally encouraging them to be more autonomous. With the combat veterans, it was exactly the opposite. It was a lot of showing them that they didn't have to be in charge right now, that I could take the reins and they could chill out, and I'll make sure we stay on track.
Yeah.
So there were some differences in approach.
Yeah, it's interesting because I have worked with state troopers and firefighters.
Mhm.
And it's really, really tricky because if they want to go back to their job, part of what makes them really good at what they do is being able to ignore
Right.
all of
Yep.
the intuitive yelling that goes on inside our head saying, no, don't enter that building, right?
Yeah.
Or that guy's got a gun, right? It's really, really tricky work.
Yeah.
I also will tell people that that our relationship is more a collaboration than it is me expert and you client. And that I will differentiate when I give you information, I will differentiate between what I've read in terms of research. This piece is coming based on research that I've read. This piece is coming based on what I've seen clinically that hasn't necessarily been documented, but I see a lot of it and I hear a lot of it clinically. Or this has been my personal experience, because ultimately my job is to help you acquire needed resources,
Mhm.
as opposed to change you. You are the only one that can change you.
Yep.
So I will be as transparent as I can in relationship to what I give you so that you can decide whether or not it's meaningful for you.
Yeah. I think you helped me just there sort of articulate in my mind what the difference is with coaching. Because the relationship is still, in my eyes, paramount.
Mm-hmm.
And what I find, so in my coaching practice, it's not a requirement that I coach people who have past trauma and adversity. It's
Right.
just I specialize in that because I understand from where they started to here. I have some intimacy with that process. And so I think what differentiates the coaching is, instead of starting and building that relationship through relieving symptom distress, a lot of the relationship gets built through clearly defining what people want. And unfortunately, a lot of folks who have trauma histories or adverse childhood experiences, even when they're not symptomatic anymore, even if they've been through EMDR or whatever and they're doing really well, have a lot of difficulty with self-worth.
Mm-hmm.
They feel like everything they need to be doing is to earn their worth and value from somebody else, right? To get approval, and because at baseline, if they're not doing something to earn it, why would anybody want them around?
Right.
And so goal setting, you hear all these cute acronyms, right? The SMART goals are specific, measurable, achievable, realistic, and time bound. That's great. But when you're working with people with histories like this, to me, in my approach, it's vital to understand their motivations. I had somebody, a coaching client, talk to me about 2 separate sets of goals for his business. And the 2 goals were completely incompatible with one another. Like, it was almost impossible to achieve them simultaneously. Like, achieving one almost negated the other, and they're like mutually exclusive. And what we found was one of those goals was very clearly related to what he wanted, what he valued in himself and in his business, and in himself as a provider of his business. The other goal was very much about feeling like he's supposed to leave a legacy. Mm. And so hashing out which is the bigger motivator for him, or if maybe one of those things could get met somewhere else, right? Is there a different way to leave a legacy so that the business goal can be based on what your real values are? And so there's a fleshing out period like that. Somebody doesn't sit down with me and say, here's what I want to achieve. And I say, okay, let's make it specific, measurable, achievable, right? There's this process of what motivates that first, and understanding yourself enough to know what's driving you to want that in the first place. Because a lot of the things we think we want are really things that society tells us we ought to want.
Right.
Like six-pack
Right.
abs.
Right.
Most
Absolutely.
people really don't want the lifestyle that comes along with six-pack abs. It's a lot of restriction, right?
Right.
And so if you're a fitness model or a competitor or an actor, yeah, you get your six-pack abs and you end up with a multi-million-dollar movie contract. And so it's worth it to restrict your lifestyle for a few months. For the rest of us, all that restriction, the big payoff is, you go to the beach and somebody walks past you, he's like, oh, that person looks good. And they move on, and it's just not worth it, right?
But right, that there's a, for people who, I mean, there can be, it's armor, right?
Yeah.
It can be armor.
Right.
It's interesting as you talk, because I realize that if I were to ask the majority of my clients to envision the life that they would like to have, that most of them cannot.
Yes.
Other than the absence of the crap,
right,
that's going on in my life.
Right. And I would be very quick to talk to people. And this is why this is a conversation that, in my opinion, it happens best with people who are not acutely suffering from symptoms, right? Because the conversation is, knowing what you don't want is a start, but it's not the same as knowing what you do want.
Right.
Right. Eric Fromm had that whole freedom from versus freedom for idea, right? Freedom from is very easy. It's easy to know what you don't like. If I'm sticking needles in you, it's very easy to know you don't want that anymore.
Right.
It's much harder to know. This is why people fight over what to have for dinner, right? What do you want? Oh, I don't care anything. Well, how about pizza? No, don't want pizza. Okay, well then what do you want? Oh, I don't care anything, right? Freedom from knowing what you don't want is easy. Knowing what
right.
you want is tough. And so while I don't necessarily consider myself like a solution-focused therapy guy, I do use that kind of miracle question approach to start to paint a picture of what life might look like. And one of the things I do in coaching, or one of the approaches that comes in handy a lot, is the idea that, you don't have to see the whole staircase to take the first few steps.
Right.
You can move in a direction, and we can adjust trajectory as we make decisions moving on, right? If we want to. But yeah, it's, when my way of doing it is that when I dig down into what motivates those goals, where those motivations are, that typically makes it a little easier to start to paint the picture of what we do want, right? If the motivation is for peace, or if the motivation, like peace in your lifestyle, versus the motivation to have financial comfort or stability,
Yeah.
or the motivation to give back, to be generative in that way, that kind of helps. But yeah, I think when people are acutely suffering, what they don't want is so in their horizon that it's really tough to say, okay, well, let's think about what you do want. They have to be.
Yeah, I think that a large portion of those people who are traumatized, we tend to go to one side of the coin or the other, right? We're either so a lot of people come out of their trauma experience being needless and wantless, right? Because you can't, you're surviving. There's no such thing as, what do I want? And everybody else's needs come before. So it's just been interesting, because as I move into whatever this next phase is, I'm very clear that there are a couple of things that are required, and one of them is vision. I need to have a vision. Another thing is just building on structure.
Yeah.
So for instance, when you said, you don't have to climb the whole staircase, it only, you only have to take a step or two. That everything you do, right? This is a very old statistic. I don't know how it whether or not it's still accurate, but when I was going through my master's program in addiction, there was a lot of conversation of, it took about 16 interventions for a adolescent who was drinking heavily or using drugs. It took about 16 major interventions to get them into treatment. But, intervention 2 or 3 is closer to 16 than intervention 1. And so that process of, it's so easy to get derailed and pulled away from your vision and your your daily routines or practice. Like, so one of the things I'm doing is writing. Okay, well, I have to write if I want to write. The idea or the concept or whatever I'm doing is not going to pop in my head. And if I don't create a time and a space to do that on a regular basis, it's not going to happen because life's going to take over. Right. So I'm imagining that is part of your practice in terms of coaching as well.
Correct. Right. And so understanding, on a very cognitive level, but I still try to deal with people's visceral sensations and emotions. The drive to write, for example, right? It's important, especially for somebody who says they want to write and sort of time and time again fails to get writing done.
Yes,
right?
Absolutely.
Understanding the motivation to write becomes very important, because that helps sometimes, not always, but often helps to identify the obstacle, right? Whether the obstacle is that the motivation isn't really that you want to write, it's that, a parent wanted you to write, or that a therapist told you to write, or maybe the motivation is that you've always wanted to write so much so that you're terrified of succeeding at it, right? And so how you approach those goals is going to differ based on, I think, especially for people who haven't had the trauma history and people who are just maybe a little struggling with motivation or organization or whatever, they come to you and they say, hey, I want to write, but I haven't been able to. You go, listen, here's a website full of writing prompts. You set your alarm for 6 to 6:45 every day. You pull up a writing prompt and you freeze it, right? And that's great advice, unless what's in the way is deeper than a lack of skill.
Right. So then how do you decide where that bottom depth lies for you as a coach as opposed to a therapist? Does that question make sense?
Yeah, it does. It does. I think I know what you're saying. And so I would say that bottom depth, I don't decide. Right.
The client.
You asked where I decide, how do I decide?
Yeah.
Depth? I don't decide. Right. I work with people. I try to meet them where they're at, right? The old therapy, you meet people where they're at. And I progress at what I would try to keep as like a reasonably moderate pace and create an environment where people are hopefully empowered to speak up. Because again, I'm not dealing with people who are in the throes of a diagnosable condition. So hopefully they're willing to speak up. But I progress based on the best information I have at the moment. So if I talk to somebody and we talk about their motivation for writing and it seems like they want to do it, and we, start with whatever approach to get them writing, just as an example, and a week or two go by and they keep not, then I start a different conversation with them and try to dig a little deeper if I can. And then I get new information, hopefully. And based on that new information, I might adjust the approach and see if that's helpful. And if it is, then great. And we try to build on that. And if not, then I revisit the conversation again. Right.
So I'm, and if I'm confused and I'm a therapist, then I'm sure plenty of people out in the world who are not in the midst of all of this would be confused. How do you then differentiate? Mm-hmm. Like if you're doing that dive into the obstacle, mm-hmm. I guess how do you decide then when you're a coach and when you're therapist? Like, how does that
So,
work?
right. So the way it works is if what's in the way is, you know, I hate to be super medical and super clinical because that's not really my approach, but if
Right.
what's in the way are symptoms, right? If what's in the way are symptoms of depression or symptoms of anxiety or symptoms of PTSD that you would find in a DSM, and there's to such an extent that the person can't manage them, because I'm willing to coach somebody while they're in therapy if it's doable, if they're working.
Mhm.
But if they have symptoms of a thing that are in the way of them progressing, then I talk to them about a referral and I talk to them about going to get some therapy. If what's in the way are, old narratives or old scripts or a lack of belief in their self, or those are things that therapists can work on, but those are not really diagnosable clinical presentations, right? And so I'm willing to work on those. And I use a lot of my soft skills as a therapist to do that, but I'm not treating a diagnosis. I'm not, my outcomes are not going to be measured on a symptom screener, for example.
Right.
My outcomes are going to be measured on, and that's part of how I start with my folks too, is designing how we're going to measure the outcomes. How
Yeah.
are we going to know that we've been successful? And so there's a little bit of judgment. There's a lot of judgment involved. I try to make it collaborative with the person. But if they're so depressed that they can't get out of bed to do that workout or to write, that I'm going to make a referral for therapy. I'm going to talk to them about maybe if they're willing to take that referral. But I'm not going to do more harm by pushing them to achieve something they just don't have the energy to do.
Yeah.
Right?
That makes a lot of sense. That makes a lot of sense. And so you're sort of talking about if there are unmanageable parts of their life that are affecting how they live their life,
Right.
that becomes really a therapeutic issue as opposed to a coaching issue.
Exactly.
And the coaching issue is really about sort of creating new versus managing old.
I've had a person whose family dynamics were in the way of achieving what they wanted. And so in that instance, that person was willing to accept a referral to a family systems sort of therapist, and their partner was willing to work with them. And I worked with them on the coaching piece while they were in therapy, because again, it wasn't a diagnosable condition that was in the way. It was an interpersonal kind of piece. I didn't do the therapy with the family, right? I sent them to somebody else for that. But I was able to, because the family therapist was in my network and the person was willing to, sign a release and have me involved in that, we were able to create a plan collaboratively with the person's partner and children on board so that it supported what this person wanted to achieve while the family was still able to, function how they needed to function.
Right. That makes a lot of sense. And I think it's very helpful to delineate how you think about coaching as opposed to therapy.
Yeah.
Although I would have to say that not all therapists operate under a diagnosing system.
No, sure.
Right. We all have to be familiar with it, and
Right.
we have to use it if it becomes necessary. But as a systems person, nothing happens in isolation, right? Even the Unabomber has to be apart from culture to be the Unabomber. And so culture and people are in the definition of, right? It's an absence of that. So so that's very helpful. Thank you.
Let me also say that part. So it doesn't, thankfully, mercifully, it really hasn't come up a lot that the waters are muddy about like what's therapy and what's coaching. Doesn't come up often, but I had this concern more in my mind when I thought about opening a coaching practice. I was worried about it more than it's actually come up. And so what I thought, which is helpful to me, and see if it makes sense to you, is I start with what's simplest. And what's simplest is a straight continuum. Right in the middle is baseline, right? To one end of the baseline is like symptomatic or diagnosable or right, clinical. And to the other side is growing and thriving, right? And so I start with what's simplest. And if I can simply say it's on this end of the continuum or that end of the continuum, that makes it a little easier. Very few things are that simple.
Right.
Usually there's a little bit of distress and some growing and thriving. And so I then I think about it as like focusing in the complexity on the telescope, right? And I focus in. But here's the paramount piece. If I ever get to a situation, which I haven't so far, knock on wood, where it's just so muddy that I can't tell. The first thing is, I think I would consult. I think I would talk to my therapist friends and say, give me a sanity check here. Am I doing okay, or should I? And in all likelihood, if it's really that muddy, I'm going to have a heart-to-heart with the person about this might not be the right time, right? If you're ready for coaching and wanting to achieve either your professional goals, your personal goals, your fitness goals, it should be pretty clear that you're ready for that, and that the obstacles in the way are not clinical, right? And so if it gets even that complex, I think I would probably err on the side of caution and say to a person, hey, listen, let's resume this when you've done a little bit of work on what's in the way.
Yeah, that makes sense. Yeah.
So I'm noticing our time, and I want to be respectful because
probably close to another 2 hour, right?
Yeah, pretty close, but worth it. It's been a great conversation. I've enjoyed this immensely.
I do have something that I need to, one of my favorite quotes about the work that I need to, let's see, that I need to put out there. I had set it aside. So it's a quote by E.E. Cummings. And it's not here. All right.
Is it what about it takes courage to grow up and become who you really are?
It's probably, so basically the quote, this isn't word for word, but it basically goes, anybody can think or know or believe. But if you are thinking or knowing or believing, you are thinking or knowing, believing things that other people have said.
Right.
The moment you feel, you're nobody but yourself.
Yep. So I found it. Anybody can learn.
Clearly faster.
It's okay. I've got my trusty phone. Anybody can learn to think or believe or know, but not a single human being can be taught to feel. The moment you feel, you are nobody but yourself in a world which is doing its best night and day to make you everybody else. Means to fight the hardest battle which any human being can fight and never stop. Yeah,
that sort of sums up the whole thing for me. It's such a wonderful piece of work. Right.
Yeah, that's a gorgeous quote. And it fits from what I know of you. It's a good. So you beat me to it. I was going to ask if you had any closing thoughts. So I'm glad.
That's my closing thought.
Yeah. Do you want to share any contact information if people want to reach you in some way, have questions or comments, or looking for a therapist in Eastern Pennsylvania somewhere?
Yeah, they can just reach me at my email address, which is Dr. Jen Sparks, DrJen sparks@gmail.com.
Terrific. So if you have questions or comments for Dr. Jen, that's the way to reach her. For reaching out to me, my website is Growth and Thriving, all spelled out, GROWTHAND, thriving, THRIVING.com. On Facebook, our page is Growth and Thriving, not spelled out, with an ampersand, Growth and Thriving LLC. The two Facebook communities, which Dr. Jen has been really valuable. I've loved the input that you have.
Oh, thank you.
It has been Growth and Thriving After Trauma and Thriving Fathers, Parenting After Trauma. On YouTube, it's also Growth and Thriving LLC, where you can find these podcasts. I want to thank everyone for either watching or listening. I so appreciate your time and your choosing to spend time here with me and my guests. And please, by all means, subscribe, like the podcast, comment, questions. I will respond to everyone. So Dr. Jerry Sunshine Novak, signing off for now. Thank you for your time. Take care, everyone.
Thanks, Jerry.